Hello, my name is Dr. Jennifer Hone, and I'm thrilled to be able to talk with you today about type 2 diabetes. So, what I hope we can do is talk about why diabetes is important to the general community, how it reacts to being infected with COVID, how it relates to that, and how you can think about everything from diet to exercise to medications and what kind of care you need to stay healthy. So, diabetes used to be thought of as just a sugar problem. If you had diabetes, everybody was worried about your blood sugar, and that was the main focus. But we now understand more and more that diabetes has to do with an underlying set of problems that increases people's risk for everything from heart attacks to strokes to vascular disease, meaning thickening of the lining of the blood vessels in the legs and other parts of the body. And so, thinking about treatment and how you think about diabetes has everything to do with not just controlling sugar, but actually reducing your risk for all of these other problems. First, it's really important to understand the basics. In other words, what is diabetes? How does insulin work normally? And what are the different kinds? So, understanding how insulin works is the first important concept. When you eat and sugar goes into your bloodstream, it just goes around and around and around unless there's some signal that tells the cells of the body to take the sugar out of the blood and put it into the cells to be used to make energy. That signal is insulin. So it's as if your stomach delivers the sugar to your door in your bloodstream, and insulin is the key that unlocks that door and allows that sugar to be brought inside to be used to make energy. So once sugar is inside the cell, insulin continues to drive the process of driving that sugar into the factory that makes it into energy. So, what is diabetes? Diabetes is just a gap between how much insulin you make and how much insulin you need. So, needing more insulin is called insulin resistance. The demand for insulin, in other words, is high. It takes more insulin to do the same job. Insulin deficiency is is related to how much insulin you make to meet that demand. So even if your insulin supply is high, if your demand is really high, that supply may not meet the demand. So it's that gap between supply and demand that causes high sugar in the blood. And that relates to the different kinds of diabetes. So type 1 diabetes, most people have a normal normal demand, but no supply. And the reason that this happens is that the immune system, whose job it is to go around to your entire body all the time and look for foreign things like bacteria and viruses, looks at the cells that make insulin, usually around the time of birth, and starts thinking to itself, I'm not sure that's really you. And the body starts creating this response to those insulin secreting cells to the point where they become inflamed and they die faster than new ones can be made. So, type 1 diabetes means that you make none of your own insulin, and it can happen at really any age. The difference isn't the process, but the speed at which the process happens, where the body destroys those insulin making cells. It is more common in younger people, but it can be diagnosed at any age. And it means that you need to take insulin to survive. If you don't get insulin after a couple of days, people will get so sick that they end up building up acid in their blood, become very ill, and need to be in the hospital, and sometimes die. Type 2 diabetes is by far and away the most common, where type 1 diabetes is about 5% of adults with diabetes in America. 95% of the people who have diabetes in the US have type 2, is the most common kind. And it's the kind of people typically associated with folks who tend to carry more weight, especially in their tummy, and who tend to be older. But we're increasingly seeing type 2 diabetes even in adolescents. So it's becoming really an epidemic in the United States. And as a result, again, of this gap between the demand for insulin, which is typically high, both genetically and because of being overweight and sedentary potentially, and due to an inadequate supply. So people are born with a certain amount of insulin resistance that's related to genetics. And as we get older, we all tend to have a little bit more insulin resistance. But what really tends to happen initially is that we make a lot of insulin to meet that demand. And then over time, as we get older and less active, perhaps more overweight, but not necessarily, that ability to make insulin to meet this demand decreases. So again, it's the gap between the supply and the demand that makes the sugar go up in the bloodstream. I'm sorry, that's my cat who wants to obviously be part of this conversation. So, when we think about what causes type 2 diabetes, it's important to understand that it's a combination between genetics, how you're born, your ethnic group, um, and lifestyle contributes. But there's really no gain to blaming yourself or anybody else for getting type 2 diabetes. We all know plenty of people who carry a lot of extra weight who do not have diabetes. So what's the difference between people who do and people who don't? There's still a lot we have to learn about that, but clearly some of it is genetics. So the treatment is to address the supply and demand and to help prevent the complications that go along with this underlying high demand for insulin resistance that also contributes to the risk for cardiovascular disease. I really am sorry about the cat. It's been a hard week. So, gestational diabetes, just to briefly go over that, just means basically diabetes or high blood sugar that's diagnosed during the time when a person is pregnant. And although it can resolve and almost always does after pregnancy, it means that if you have gestational diabetes, that your lifetime risk for type 2 diabetes is 50%. So this is really kind of a wake up call. So for women who get diabetes during their pregnancy, it's a great idea to pay attention to that and to do everything you can to change your lifestyle to be healthier for the rest of your adult life to prevent type 2 diabetes. It's also important to realize that the offspring of women who have diabetes during their pregnancy are at higher risk for both obesity and diabetes. Sorry. Okay, so who is at risk for getting diabetes? It turns out that all of us over the age of 45 are at higher risk and should be screened every 3 years. If you're a member of a certain ethnic group, meaning if you're African American, if you're Asian American, or if you're Hispanic, your risk is higher. Being overweight, especially carrying it in your tummy, I always tell people if your belly button arrives through a doorway before your nose, you're at higher risk. A family history means you're at higher risk. And having high blood pressure and a type of high cholesterol called high triglycerides puts you at higher risk, as does being sedentary. My office assistant here. So, how do you know if you have diabetes? So, you get your sugar level checked by your doctor, and you need to understand that there's a difference between the criteria for fasting, meaning you haven't eaten or drunk anything but water since the night before. Black coffee, black tea are okay. So, fasting is normal, less than 100. You have what's called pre-diabetes, or you have an impaired glucose level if you're between 100 and 125, and frank diabetes if you're over 126. Meanwhile, 2 hours after eating a large meal or after a specific glucose challenge where you drink that lovely syrupy stuff that some people may remember from being pregnant, your sugar should always be less than 140. So I always tell my family members who are at higher risk, if you have a quart of ice cream, your sugar should still be less than 140 if you're normal. So there's nothing in a normal person that will drive your sugar over 140. If it's between 140 and 199, again, you're considered pre-diabetic, and over 200, diabetes is diagnosed. You can also be diagnosed by the use of something called a blood test that you can get at the lab called a hemoglobin A1C. A hemoglobin A1C measures how much sugar is stuck to your red blood cells at any one time, and it reflects what your sugar's been over the last 3 months. If your A1C is less than 5.7%, you're normal. If you're between 5.7 and 6.4, you're considered to have pre-diabetes. And if it's 6.5 or higher, that's consistent with diabetes. But that test needs to be repeated at least once to be confirmed. So most of these tests, unless you're really quite elevated, most doctors would recommend repeating them to confirm it, especially if you're in that pre-diabetes kind of uncertain gray range. So if you have diabetes or pre-diabetes, what should your goals be of treatment? So the idea is to get your blood sugar as normal as possible without causing yourself to have side effects from medications or having a frankly low blood sugar. So A1C goals for most people are to be less than 7%. So, how do you manage diabetes? I mean, this is really the question, the big question. And can you reverse it? Is diabetes, quote, curable? So, I just like to quickly address that question first. And the answer is I don't really believe you can cure diabetes, but you can definitely put it into remission. And you do that with lifestyle change. And that means things like weight loss and activity. Not everybody is able to be more active. I mean, I'm on my way to have my second hip replaced, so activity is hard for me. It hurts. But all of us can approach the way we eat differently. And it's things like restricting how much simple sugars we eat, trying to eat more vegetables and stay away from candies and things that come in cans and boxes wherever possible. Whole foods, more plants, less meat. All of these are strategies that can help you live healthier based on how you eat. There's a lot of controversy over what is the right diet. And I always tell people that the right diet is the one you stick with and the one that results in you losing weight and keeping it off and feeling good. Some people will try these keto diets and feel like dog poop. And, there's just no way that you're going to stay on a diet that makes you feel sick all the time. On the other hand, you can become not exactly ketotic, but at least carbohydrate restricted and really actually gain a lot. And the important thing in those diets is, again, is to eat a lot of green leafy vegetables to avoid getting constipated. Um, there's some data that some people are really strongly believe in that staying completely away from animal proteins may help reduce cardiovascular disease. That's the Dean Ornish system. It's actually been proven scientifically to even reverse heart disease. But from a diabetes perspective, weight loss is really the key. And so if you lose weight on the Ornish diet, then you will also find that your diabetes may resolve or at least be well controlled, and you may need a lot less medicine. But let's just assume for the time being that in the absence of a lot of coaching and support, you're able to make some changes, but not as many as you need to stay in control. Then you're likely going to need medicines. And everything we do for diabetes involves either reducing how much insulin you need, so the demand side, or increasing the supply. So the first thing we try to do is reduce your demand for insulin, and that's the diet and exercise thing. If you want to come walking, we walk every Thursday night at Shoreline Park at 6 p.m. Everybody's welcome. We meet at the upper parking lot by the fence. Even in the dark, yes, even in the dark. There are other medicines that are available besides lifestyle that can help reduce your demand for insulin. Most people consider metformin, which is third on this list that I have here, to be the primary first line medicine for type 2 diabetes. And most people who have diabetes, if they can tolerate it and they don't have any reasons, what are called contraindications to using it, will be put on metformin. The other medication classes that can be helpful are Precos and Glycet, although those are really tough to tolerate because they cause a lot of bloating and gas. I don't know if anybody knows somebody who has had problems with alcoholism, but if you are an alcoholic, sometimes you're given a drug called antabuse, which makes you sick if you drink. I consider Precos and Glycet kind of like antabuse for carbohydrates, because if you take those medicines and then you eat carbohydrates, it can make you really sick to your stomach. Other medication options include thiazolidinediones. The only one currently on the market right now is Actos or pioglitazone, and it directly impacts the way the body uses insulin to improve your body's response to the insulin you already make. So, in order to use these medicines so far that we've been talking about, your body actually has to make some of its own insulin. So, just to reiterate, none of the medications we're talking about today are to be used with type 1 diabetes unless very special circumstances are met. And you'd want to talk to your doctor about that. So, the other system of the body that we haven't yet talked about is a hormone that's made by the large intestine called GLP-1 or glucagon like peptide 1. That is a really interesting hormone that helps our body. Be less hungry, so it slows down the emptying of the stomach. It primes the insulin making cells to help them make insulin in response to a glucose load. It makes you less hungry. It actually talks to the brain and says, hey, maybe you're not so hungry. So it's a really interesting medicine that also suppresses the pro glucose or pro sugar hormone in the body called glucagon. So it turns glucagon off. It starts the insulin production process. It slows down how quickly the food goes from your stomach into your bloodstream, and it makes you less hungry. It's a really interesting system. In type 2 diabetes, it's really common for people to either not make enough GLP-1 on their own or for their body to not use it very well, to essentially be GLP-1 resistant. So there are relatively new medications that either mimic GLP-1, that's the first group, the Byetta, Victoza, Trulicity, et cetera, or pills that currently block the breakdown of the GLP-1 you make. So those are so-called gliptins that are listed there, and there are others as well. Lastly, there are SGLT2 inhibitors, Invokana, Farxiga, there's a whole bunch of them now, and they work by increasing how much sugar you lose in your urine. We used to diagnose diabetes just by doing a urine test and looking for sugar. It seems crazy that we'd want to actually make your urine have sugar in it. But actually, by doing that, you can lose weight as well as lower blood pressure. It works kind of like a diuretic. But there are side effects to all of these medications that you should discuss with your doctor. The cool thing about the GLP-1 um, agonists, the Byetta, Victoza, that group, is that they not only can help people lose weight. There are new studies that show that they actually reduce more the risk of another heart attack or stroke and the risk of dying from heart attacks. So they're a very powerful class of medicines that are being used, even sometimes when people don't need them for their sugar lowering, they just need them for this risk factor modification. Similarly, the SGLT2 inhibitors have been shown to help people who already have kidney problems to slow down how quickly their kidneys poop out on them. So once people have severe damage from diabetes on the kidneys, that damage tends to progress over a certain amount of time to the point where people need dialysis, something that nobody wants. And these medicines have been shown to slow down how quickly your kidneys poop out. They're also helpful in people who have congestive heart failure, probably again because of their diuretic-like effect. So, what about insulin supply? There are basically a few medicines that increase the supply of insulin that your body makes. Those are the sulfonylureas, the meglitinides, and those GLP-1 medicines. Amylin and Symlin are not used very much. They're an analog, if you will, a manufactured hormone called amylin that our body normally makes with insulin. And so you can imagine if you're insulin deficient, you're probably also amylin deficient. But it turns out they're pretty tough to take. They have to be given before every meal as an injection, and they're just not very convenient. And they're fairly expensive. And then, of course, there's insulin. So, bottom line is diabetes can be prevented or at least delayed by diet and exercise. And in some cases, you can even go the other direction. You can go into remission with significant lifestyle management. It's just those changes are not easy to make, but there are systems out there, there are companies out there that can help you make that happen. Supplements probably aren't helpful. People often ask me, well, should I be taking cinnamon? What about turmeric? What about, and honestly, the studies on those supplements suggest that they do very little, if anything at all. And some of them can actually be dangerous. So please always consult with your provider if you decide to try one of those supplements. Keep in mind that diabetes is an imbalance between how much insulin you make and how much insulin you need. And that if you do get diabetes, controlling it can prevent a lot of the unpleasant complications. Don't ever let anybody blame you or make you feel bad about having type 2 diabetes. It's not your fault. That doesn't mean that you can't do something about it, but it's not your fault that you got diabetes. So don't let people or doctors, for that matter, make you feel bad. The more you know, the better you'll do. Knowledge is power. Get help. There's lots of great organizations out there that can provide help. And I've listed just a few of them here to give you some resources of where you can go to get more information. I hope that this has been helpful to you. I look forward to hearing from you. And I really thank you for your attention today. It's been really a pleasure.